I'm Dr. Arun Shah. I'm a Director of Neurosciences at Sir H.N. Reliance Foundation Hospital. We are joining on Facebook Live on the occasion of World Alzheimer's Day. World Alzheimer's Month and Day is probably celebrated every year with a focus on increasing awareness of this disease and to institute preventive aspect of this disease. The Lancet Group Commission has recognized that there are 14 risk factors for Alzheimer's disease, and if you take care of these risk factors, you can prevent this disease. And World Alzheimer's Day is basically focused on implementing these 14 preventive risk factors all over the world. The dementia is a very burning topic in the world, and the commonest cause of dementia is Alzheimer's disease. How do we recognize this disease? This disease, the person who is affected with this disease will start off with memory impairment at the first symptoms. He forgets recent conversation, he would forget recent events, he may forget recent appointments, and this probably does not allow him to function independently. After this, probably additional symptoms keep on happening, which will consist of difficulty in planning or executing simple tasks day to day, difficulty in judging people, difficulty in remembering relationship of people, difficulty in remembering names of people. Probably while conversation he may forget words which he is supposed to use. And so along with that, they also have change in personality. They may get depressed, sometimes they may get agitated, they may be repetitive. And then they have also visuospatial problem. They may not know how to interpret a picture, and they may they probably lose their way in a familiar atmosphere because they don't know how to go around, and they may mistake in driving. They may keep things in unusual places, and probably they may not go back to trace where the particular thing was kept. So these are the usual symptoms which will consist of cognitive impairment, memory impairment, language dysfunction, and change in personality and behavior. This is the crux of the early symptomatology of Alzheimer's disease. Now there are a lot of treatment advances which are occurring, though at the moment bedside we are not able to offer treatment for many of these individuals. So early diagnosis is key to the treatment because it is presumed that an abnormal protein, amyloid, is accumulated in brain of patients with Alzheimer's disease. So if you reduce the amount of accumulation of this protein over a period of time, the disease progression may be halted. On the basis of this, there are various products available which are being tried out, what is known as anti-amyloid therapy. So what we do is diagnose Alzheimer's in a very early stage, that is at the stage where it is just very MCI or mild cognitive impairment, and he is still not gone to full-blown dementia. Such patients undergo imaging to see what is known as amyloid PET imaging, see the amount of amyloid in the brain, and then if the brain amyloid is slightly increased in these people, we make a diagnosis of Alzheimer's disease with amyloid accumulation, and then they are offered this treatment which is once a month or once a week treatment, and it has to be continued for a few years, and that will probably reduce the amyloid burden and the dementia may get halt. Now, of course, at the moment we don't have this treatment available. What we have right now is a symptomatic treatment which will consist of changing probably the chemicals in the brain like acetylcholine to be increased, or mementamine probably to NMDA receptor antagonists. These are the two drugs commonly available for treating Alzheimer's disease at present. Thank you.